It's an incredibly moving experience to see people giving up their weekends, risking arrest in civil disobedience, and trying to give a really powerful message to Boris Johnson, Rishi Sunak and his cabinet that they're going in the wrong direction. We really want to give a very strong message to Boris Johnson to stop new fossil fuel. We don't need it. We need a completely different direction of travel. Otherwise, we are really facing extremely catastrophic consequences for human health and survival. We had such a big fanfare around COP, and Britain was the host, and all the fine words were said. And then, really, before the ink on the page is dried, here we are with these new investments. And the really big sort of scary thing is that they're not necessary. It's not going to cut fuel costs. It's not going to help the people who need help in terms of the cost of living crisis. And all it's going to do is reduce our credibility in the international discussions and add to the problem of climate change. So I'm really hoping that the General Medical Council and the General Nursing Council will stand up and recognise that this has become, sadly, part of core activity for doctors and nurses, that they feel that they must, in order to protect the public, protect their patients, speak up about climate change. And if that means they have to protest, if that means they risk arrest, we need their regulatory bodies, GMC, General Nursing Council, to support them in that. It's a terrible situation that should be necessary, but we can't have really vital doctors and nurses being unable to practice because they are compelled to protest in protection of their patients and the public.